real, and we recognize the impact it can have on soldiers and first responders. Some people, though, are still skeptical when it comes to getting post-traumatic stress disorder from something like serving on a jury. Katy Kamkar is a clinical psychologist at CAMH. She joins me in studio now. And Katy, you don't have to be a war vet to suffer from PTSD.
Absolutely not. I think it's very important really for us to understand what PTSD is, because it does contribute to significant amount of disability and suffering and pain. Now, post-traumatic stress disorder or PTSD involves exposure to actual or threatened death, serious injury, or sexual violence. So, for example, it can occur when we directly experience a traumatic event, when we witness a traumatic event occurring to someone else, or when we have learned that the traumatic event has occurred to a close family member or a loved one. And of course, in a case of an actual threatened death to a family member or loved one, the traumatic event must be accidental or violent. Now, PTSD also occurs after repeated or intense exposure to aversive details of the traumatic event.
Maybe during a trial.
During a trial, or for example, we know for police officers, it could be being repeatedly exposed to details of child abuse, or for first responders, it could be collecting human remains. Absolutely.
You know, I've covered some trials where I've had to leave the courtroom because I found it so disturbing what was being presented.
Yeah.
I mean, can you talk about then the stigma surrounding PTSD and why as a society it's taking us time to recognize it as something that is real and debilitating to certain people?
You know, generally speaking, overall, we have worked very hard on reducing the stigma attached to mental health illness, mental health concerns, including PTSD. And I think we have seen some great changes within the past 5 to 10 years. But there is room for further improvement. We really have still a lot of work to do on reducing the stigma. And we really need to normalize the talk around mental health issues, including PTSD. We need to open the dialogue and the communication. No one is immune to mental health problems, including post-traumatic stress disorder. So it's important to know that whenever we are suffering, whenever we are going through any kind of psychological symptoms, and especially when the symptoms increase over time and create more distress and interfere with our function, it's very important to seek help. And the great news is that we have effective treatment available.
Dr. Katy Kamkar, thank you for your insights. We appreciate you joining us.
Thank you.